This video series is going to be about how to fix your back. It is simply me sharing with you what has worked for me. I am not a doctor, I am not a physical therapist, I am a personal trainer, and I've been an athlete for most of my life, and through that I have a pretty good base of experience, and I've done it multiple ways, and it wasn't until about 2 years ago that I started to see a huge improvement. So that's what I'll be sharing with you. A really brief history. I've had back pain since I was about 10 years old. As a gymnast, I had a stress fracture, and I might have been super strong, but I don't think I had awareness of my body. I could muscle through just about anything, but I really wasn't connected to my body. And it wasn't until I started to connect that my back started to feel better. And in truth, a lot of other things started to feel better. And so it all, for me, started with accepting. So I had to accept the fact that my back wasn't amazing, that my back was, in fact, injured, and that I could be good for a month at a time, and then I could also probably expect that at any given time, it was going to be a burden, and any movement from sitting to standing to, of course, doing athletics was going to be an issue because I was in pain, like so much pain that, as I'm sure of you know, I couldn't even really walk normal. It was awful. So accepting that my back was not that cool, I then was able to kind of assess further the situation at hand. So what was it that did hurt? Was there something specific, a specific movement that caused it? If not, if it was just this kind of like chronic thing, were there things that I could do that felt pretty good and that didn't inflame it? And what were the things that I couldn't do that definitely inflamed it? From that base, I then got into some breath work. And I had read and had been taught through pre and postnatal certifications that there's a lot of power in the breath, and if you can control your breathing, you can have a deeper connection to your core and the rest of your body. So most of us breathe predominantly through that upper chest area, and that's done for multiple reasons. A lot of us aren't aware of it, but yes, a lot of us are kind of what we call chest breathers. So if you can learn how to breathe into your belly or diaphragmatically breathe, you can gain a deeper connection to your core and, of course, your breath. So a diaphragmatic breath is kind of where this all starts, and that's where I'm going to kind of have this whole video series start from, is diaphragmatic breathing. What that is breathing down into your diaphragm. So that's going to feel kind of like right in here, like right below the ribs a little bit, into the belly, and just having nice big like belly and chest expanding inhales and nice easy exhales. If you've worked with me, you know that it goes into further stages, or maybe you've heard that it goes into further stages, but to start, we're just going to worry about diaphragmatic breathing. So to begin, you'd want to come into a comfortable position. Ideally, I would like you to be able to get it here, laying down on your back, and then also in a tabletop position, but we'll go over that. So breathing in, you're going to try to feel the air go all the way down into the diaphragm. And then as you exhale, you're just going to let it come out. There's no forcing of it in either direction. So it's obviously difficult to do this and talk at the same time. So I'm going to go through 5 breaths. I might use my hands to kind of show like where the air is at. And I'm also going to scoot in a little bit closer so that you can see it, and then I'll go through the other positions. Ideally, you would be doing this a couple times a day. If you can get in 2 minutes of this a day, whether that's 30 seconds here, 10 seconds there, 2 minutes all at once, like whatever, it will help. We need to really develop your neuromuscular connection, specifically in your core, in order for this whole fix my back thing to work. So bear with me, this is where it starts, and again, work it into your day however you can. But again, I will show you about 5 breaths in each spot and kind of just use my hands to guide. Okay, so that might have seemed silly, but it's not. So please believe me with that. But I want to also show you the next steps. So the next steps are going to be taking your diaphragmatic breath and turning it into a breath that contracts the core on your exhale. So throughout this whole series, I'll be pairing the breath with movement. I think most of the time, if not all the time, but pretty much most of the time, when you are exerting, when a movement is going to require more energy, more force, more contraction, that's when the exhale will happen, okay? But exhales are when our core contracts. So I'm still gonna have you do a nice big belly expanding and chest expanding inhale, and then as you exhale, you're gonna try to contract the core. So I also like to think of the core like this, that you've got this box, right? So you have your diaphragm, you have your pelvic floor, okay? You have your rectus abdominals, okay, right there in the center. You have your obliques, and then you have your TVA. Things that I'm going to get into more details with, but to go over this kind of quickly, you're still gonna have your big inhale, and then as you exhale, you're gonna go ahead and contract your core. So again, expand on your inhale. As you exhale, think of closing in all sides of the box. So pelvic floor is going to lift. Yes, males too, you have one. Lift the pelvic floor, compress the diaphragm, and contract the sides. Something to think about too, if you have no connection to your pelvic floor, put it into kind of realistic examples. If you stop the flow of urine, that is the engagement of the anterior or the front of your pelvic floor. If you engage the posterior side of your pelvic floor, that's as if you gotta take a shit and you can't, and you just gotta squeeze, okay? So if you engage the front side of your pelvic floor, the anterior side, that should feel like the stopping of urine. If you release that and now try to engage the posterior side, or stopping number 2, that's what that feels like. So go ahead and engage the anterior side, release, and then engage the posterior side, release. Engage the anterior, release. Engage the posterior, release. And now engage the anterior and hold that, and go ahead and engage the posterior as well. So that right there is like complete activation of your pelvic floor, and that needs to be something that you get super, super, super familiar with. That is the end of this first series.